in medical procedures like the insertion of catheters. Let's find out more from the health products regulators, Fafudi. Mokgadi, good morning. Thank you so much for joining us this morning on NewsLink here on eNCA. Let's perhaps start with where exactly, in which hospitals, in which areas were the findings that actually led to this recall?
Actually, there were several provinces that were affected. This was reported by various provinces. The first one was the Western Cape, and this product is used mainly in hospital settings, and it was both the private sector and the public sector that has reported this to us.
Do we know how many cases? My apologies for interrupting you, Mokgadi. I'm asking, do we know how many cases and how severe the impact was on these patients?
I won't be able to give you the exact number, but it involves several batches that were involved. Although, remember, this is a contaminant, not all the cases resulted in infections that were concerning. But because there was a number of batches that were affected, therefore the regulator deemed it fit that, no, this product cannot be continuing to be in the market, especially when the root cause for this contamination has not yet been identified by the manufacturer.
Just for our understanding, let's perhaps talk about what exactly this lubricating gel is normally used for. What kind of procedures? I tried to explain a little bit in my introduction, but just for our education, perhaps, what is it normally used for?
Okay, so it's a lubricating jelly, which is a medical device, and it is usually used to lubricate the catheters for ease of the passages, the ease of the passage of that catheter through the, for example, the urethra into the bladder. It can also be used for your ultrasound. It can also be, it's usually used in hospital settings for medical and surgical procedures. So therefore, it has to be sterile when being applied to the catheters. Hence, as soon as those cases were identified, then we needed to communicate directly with the NICD, the Department of Health, together with the company to just look at the extent of the batches that are involved and see how best can we therefore work with this together with the institutions that have reported this. And the decision was that we recall this with immediate effect.
Now, this recall is being classified as a Class 1 Type A recall. Just give us some clarity with regards to what type of classification this recall is.
Okay. So before maybe I speak about the type, I just want to also add that you have got your patients such as your paraplegics who might be using the catheters on daily basis in their own private settings. So there are also those kind of use. People can use them also privately. These are also available in retail sectors, in pharmacies, in clinics. So yeah, because looking at the distribution pattern of this product, this Class 1 Type 2, Class 1 Type 1 recall is a recall that involves all the distribution levels at no matter whatever point of the channel the product is at, we are recalling it from there. And in terms of the classification, it's about the seriousness of this contamination. You don't want to put people at risk because people who are immunocompromised, we know that in South Africa, there is quite a large number of people who are immunocompromised. And also when you are in a hospital settings, already you are your health is compromised. So you don't want to be spreading infections in hospital, nosocomial infections. So therefore, because remember, when it comes to the fungal, it's a fungus. So a fungal infection can cause different types of infections. Like if it goes into the bloodstream, there can be fungemia. There can also be urinary tract infections and any other types of infections that we don't want people who are already compromised to be exposed to. And as I mentioned that the root cause was not identified by the manufacturer, we therefore had to then say, this is serious, and we therefore are not going to allow it into the market. So Class 1 means that you don't want to, it can be of serious risk to the people's health, and therefore you want to eliminate that because this is used mainly in hospital.
As you said, this can be of serious risk to the people's health whose immune systems are already compromised because they are in hospitals, like you said, seeking medical attention. Now, we know that fungal infections can range from mild, and in very rare cases, there can be a severe reaction to the infection. In the cases relating to this gel, was it mild cases that was traced at the moment? What was the impact on the patients?
We are still working with other stakeholders in the health industry. Like I mentioned, we also rely on the NICD and hospitals for more information. There were cases where the contamination was detected, however, did not result into infections. And we are closely working with the company, which is Electrospirus, which is very also cooperating to ensure that this problem is eliminated. At the moment, we do not have serious cases that has been reported, but we are monitoring the situation, and also we will be witnessing the destruction of all the recalled products, working with this company, the manufacturer.
Mokhari, I know that some of our viewers whose family members might be in hospital at the moment might be worried when they hear this conversation. Can you put their mind at ease? Has all the lubricating gel been removed from hospitals? Are we safe in hospitals?
Yes, they are safe. This is one brand, Lubri A brand, which is by Electrospirus. And they have been recalled, and the public can be, and the people who are in hospital can be rest assured that the provinces and also the healthcare professionals are aware of this problem, and they have made sure that this brand currently they are not using. And there is constant monitoring, and also the NICD is also taking this very, very seriously together with the National Department of Health. So there are other gels that are being currently used, and people must not panic. It's only Lubri A that is affected, the sachets and the tubes. And there is no more manufacturing of any batches going forward up until the root cause is identified, and also SAHPRA has evaluated the safety. And just to make sure that the public will be safe, they have to use it again.
In conclusion, perhaps, let's then talk about precautionary measures for those patients or viewers who might be having this product at home or who have come into contact with Lubri A. What should they do?
Immediately, or as soon as they can, they need to return it to where they have purchased it. And also, there are other brands that are available. They must just make sure that those are the brands that are certified. And also, if what we can just say is that they can also verify with the regulator on how they can get more information. The manufacturer is also, the contact details of the manufacturer is also available for people who want more information on what they can do when they are concerned regarding this product. But until it has been proven to be safe, nobody must be in possession of it. They need to return it as soon as possible where they have purchased it. But the public must just be calm. There is nothing to really panic about. There are other lubricants that are available in their health settings that they can be able to use. But Lubri A, in particular by Electrospirus, should be avoided.
Thank you so much for that very important update this morning, and also advice on what you should do should you have this product in your care. That's, of course, Mokhari Fafudi from the Health Products Regulator. We now move on to this story. Almost 30 initiates have died in the Eastern Cape as the initiation season begins. Now, this has got the provincial government very worried. It's laying some of the blame on a lack of traditional nurses. It says many initiates are being neglected.
You would find that kids are alone in the traditional initiation school.